Tu sais, mon père, là, il était merveilleux, là.
J'ai 55 ans, mais c'est ça, je suis très en forme.
If your normal number of cases is, say, one case per week, every week for 52 weeks, and then you get 3 or 4 cases, then you can raise your suspicion something is going on.
Now, can you blame the people who issued such procedures and supervised them for not doing that? Of course not. They're not chemists. How could they know?
Quebec City 2012. An outbreak of Legionnaires' disease leaves 167 people very sick and 13 dead. Public health officials scurry to find out what is spreading the bacterium. The source is identified as contaminated water cooling towers. Now, every major city has these towers because they're part of air conditioning systems. Although Montreal has 4 times as many water cooling towers as Quebec City, it seems to have dodged the Legionnaires' bullet. But has it? The bacterium that causes Legionnaires is everywhere, including in drinking water. It only becomes deadly if the conditions are right, and that's when water cooling towers come in. They work mostly in hot weather, and they're often on the roofs of buildings, giving off white clouds of steam and tiny water droplets. When bacteria-laden droplets are inhaled, some develop Legionnaires, a respiratory tract infection with symptoms that mimic other lung infections. Even if a doctor suspects it might be Legionnaires, it can take days to confirm. By then, it can be too late. Nadia Champagne and her brother Eric lost their father to Legionnaires during Quebec City's outbreak last summer.
Moi, mon père, c'était un homme enjoué, qui aimait vivre, qui aimait prendre des marches, qui aimait tout le monde, Puis au jour au lendemain, un beau petit matin, le 11 septembre, j'étais en train de travailler, puis ma mère est venue me dire que mon père il était entre la vie et la mort à l'enfant Jésus.
Gilles de l'Église was also infected, but he survived.
Ça faisait 30 ans que j'avais pas été dans un hôpital avant d'avoir la Legionnaires. J'avais même pas de carte d'assurance maladie. Il a fallu que j'aille me chercher une carte d'assurance maladie avant de rentrer à l'hôpital. Puis je suis rentré à l'hôpital à 105 de fièvre.
Ben ça a l'air qu'il commençait à tousser. Puis sa blonde, il vivait avec une femme chez eux. Puis sa blonde, ben ça a l'air qu'il est tombé un beau petit matin, puis il s'est ramassé à l'hôpital. Elle a appelé l'ambulancier, puis il est rentré à l'hôpital. Il est tombé.
Ça a commencé, j'étais comme fatigué. J'ai resté couché 2 jours à la maison. Puis quand on attrape ça, on pense qu'on a la grippe. Fait qu'on prend des aspirines ou du Tylenol, puis le mal passe. Pendant 5 heures, on n'a plus mal à la tête, on fait plus de fièvre, on pense qu'on est correct. Puis au bout de 4-5 heures, oups, ça revient. C'est comme ça, ça a été comme ça durant 5 jours. Jusqu'à temps que là, je dise, ben là, il y a quelque chose qui ne marche pas parce que la fièvre remonte, le mal de tête revient. Mais quand on prend ça, après ça, on n'a plus rien.
Puis il fallait que je prenne la décision de le faire débrancher ou pas. Okay. Puis là, ben, il était magané, il est arrivé à l'hôpital le 23 août. Il est arrivé, il était comment je peux dire ça, il était réanimé 3 fois.
Mais tu penses jamais que c'est toi là, qui va l'avoir, là. On pense jamais que c'est nous qui va l'avoir. Parce que c'est ça, le monde, il pense qu'il faut être vieux, il faut être un gros fumeur, puis il faut avoir une santé fragile. Mais dans mon cas, ça n'a pas été ça du tout.
Water cooling towers are part of every building's air conditioning system, and high-rises are something we have plenty of in Montreal. So is the risk factor lower in Montreal than in Quebec City? Pascal Flood is the technical supervisor for a property management company in Montreal. He has more than 30 years of experience with water cooling systems.
If you have it in Quebec City, you have it in Montreal. Such that it's not become an epidemic here and it's not been an outbreak, but there have been positive readings. I know for that for a fact.
The bacteria can be kept in check if water systems are monitored and treated. At the time of the Quebec City outbreak, there were no provincial regulations governing water cooling towers. With the rise in numbers of outbreaks and deaths, some feel the need to act. Alain Trahan is an engineer and the general manager of H2O Biotech. The company treats many of Montreal's water cooling systems. He's also a member of ASHRAE, an international association that sets standards in building technology.
Being a relatively new disease, or there's no norms or standards that are formally written, so ASHRAE wants to be the first one to write a standard towards eliminating Legionnaires. And Montreal and Quebec City, in being in similar climates, should have similar risk conditions. Why did the outbreak occur in Quebec City and not in Montreal? That's very hard to say. Unfortunately, I probably would have to put it to luck.
Is luck all that stands between Legionella and Montrealers? Part of the mission of the Agence de la Santé et des Services Sociaux de Montréal is to initiate, guide, and participate in prevention. The Agence says there have only been isolated cases in Montreal and that numbers are actually down. However, it's not clear why. Dr. Sandra Palmieri is a public health specialist and the spokesperson for the Agence.
You have to talk to the person in Quebec to know what might have, what might happen for them to have an exclusion this way and not in Montreal. We don't know.
In Quebec City, it was really related to the water towers.
Yes.
And we have many water towers here
Yes.
in Montreal. So,
is it the wind? Is it the temperature? Is the size of the building? We don't know.
okay. Some don't think Montreal has been lucky. Dr. Jean Joly is a microbiologist. He specializes in infectious diseases and is one of Quebec's pioneers when it comes to Legionella.
When you see a patient with atypical pneumonia, you will think about Legionnaire's disease, but it's not usually your first diagnosis. It's one of the diagnoses. The definition of an outbreak is that it is an abnormal number of cases during a time period. So if your normal number of cases is, say, one case per week, every week for 52 weeks, and then you get 3 or 4 cases, then you can raise your suspicion something is going on. But these cases need to be reported. If they're not reported or not identified, it's just too bad. You will never see the outbreak. And I'm sure that there are numerous outbreaks that were never seen. Numerous outbreaks, probably more than those that were identified.
After the second outbreak in Quebec City, the Director of Public Health mandated the Régie du Bâtiment du Québec to draw up regulations for the maintenance of water cooling towers. Liliane Gras is an engineer who works for the Régie. Her department will help building owners and professionals interpret the regulations. She says they consulted existing regulations and experts from countries like France and the US, but won't say who. The regulations go into effect May 12th.
We cannot give a list of people, of professionals who are able to do this kind of work, but they can, the proprietor who is not sure can contact a certain association and ask them if they can give them names of people who are in capacity to develop those. So it's not necessarily an art professional. It will be somebody who has the competence to do the program.
The Quebec Order of Chemists was not among the experts consulted, an oversight the group finds perplexing since the Legionnaires bacterium is usually controlled with chemicals. Philippe Boileau, a water treatment chemist with 30 years of experience, says mistakes were made last summer in Quebec City and that they could have been avoided. Mistakes that have not been fully addressed in the current regulations.
When the DSP in Quebec City issued some guidelines as to the disinfection procedures for cooling towers, for some reason it wasn't mentioned that the piping system for the cooling tower should be cleaned. You cannot disinfect the bacteria that is hiding behind a wall of calcium or iron or within a biofilm. It's very difficult. So the disinfection procedure without that first step is totally inefficient. And there's nothing in the regulation preventing that from occurring again. Frankly, we feel that should a water treatment chemist with some level of familiarity with cooling towers had been consulted last fall, the disinfection procedures would have been more efficient.
Beyond the chemistry, experts agree there are other holes in the regulations. The bill is vague, Building owners are not obliged to install inexpensive but effective drift eliminators, and there's nothing forcing them to have their water samples tested by independent labs.
There are drift eliminators on cooling towers, and these reduces the amount of water that is drifting. When they are poorly maintained, the amount of water that is drifting increases dramatically. Rather than 1%, you can go to 5 or 10%, and we're speaking about thousands of gallons of water. So these big plumes that you see are contaminated with Legionella, and if the cooling tower is not properly maintained, and the drift eliminators are not maintained also, then you've got everything for an eventual outbreak.
It's a complex system where you can minimize risk by acting on many different parts of the system. The engineer can always say, well, listen, we saw this, but we felt that it was not as important as this other portion of the system. And if the water quality is good, then the drift eliminator doesn't matter. You could answer something like that and get away with it. And so could the chemist, by the way. If you have specific regulations, then it's going to be very difficult for the professional to explain why he hasn't done or recommended something that was explicitly written in the regulations.
In advance of another hot summer, when the threat of another Legionnaires outbreak becomes more acute, the new regulations are all that stand between the bacteria, Montreal, Quebec City, and other vulnerable communities.
J'ai eu peur pas pour moi personnellement, j'ai eu peur pour mon gars qui a juste 9 ans, tu sais, la pas qui tombe orphelin déjà de son père.
Je le réaliserai jamais, puis je sais qu'il n'y aura pas de droit à ça. Parce que moi, mon père, il n'avait pas le droit de mourir à ces circonstances comme ça.
Je pense qu'il y en a qui n'ont pas fait bien le job à quelque part. J'ai pas trop de doute là-dessus. C'est sûr que l'expérience prouve que si quelqu'un avait fait plus attention, d'après moi, je ne l'aurais pas attrapé.